Good morning, good afternoon, good evening, wherever you may be watching from, and welcome to AMN Healthcare International's live show, Onwards and Upwards, where we discuss everything a global healthcare worker needs to know about living and working in the United States. I am your host, Danielle Friedman, and we have a very special show for you all this morning. We are going to be talking to a U.S. employer today, and we are going to learn all about them, where they're located, why you should consider them at the top of your list. And we are very excited. We have a great panel today. So please, if you are following along, put your questions in the chat. This is your time to learn about Monument Healthcare. We are so excited to have them on today. And let's see who is joining us today. Please post in the chat where you are joining from. We love to see where our audience is joining from. Looks like we have Amabel from Belize, Nestine from South Africa, Ninja from France. Good morning, good afternoon, good evening to you all. Thank you for joining us today. We are so excited for our employer spotlight with Monument Health. Let's talk about what we're going to be discussing today so you know where we are going to be heading. Let's bring up that coming up slide. All right, so we are going to be learning all about Monument Health. We have some of their managers, we have some of their international nurses. You are going to hear straight from them. We're going to learn where are they located? Why should you choose Monument Health? We're going to learn all about their international nurse program. They have a very robust and large international nurse program, so we are very excited to learn about that and all about the arrival and onboarding process at Monument. So without further ado, let's bring out our guests this morning for our Monument Employer Spotlight. Good morning, everybody. We are so excited to have you all here today. How is everybody doing?
All good.
Excited. I'm excited to have you guys on. I love learning about Monument. We have had Monuments on before, and you guys always do an amazing job presenting to our nurses. We love to learn a little bit more about where you're located and why our nurses should choose Monument. So we are very excited to have you all on today. Let's go around and do some introductions. We will start with the ladies first. So let's go to you first. Oh, are you guys on mute maybe? Oh, we can see you talking, but we can't hear you. This is live, everybody. Technical issues do happen. So we'll go with gentlemen first while we're figuring out the tech issues. Okay, Tristan, do you want to go first?
Hello, my name is Tristan. I'm originally from the Philippines. I've been here roughly for 2 months. I've been a nurse for 19 years, and I ventured into different fields of nursing in the Philippines, worked in Saudi Arabia for roughly around 7 years. And then just before I joined Monument Health, I was a critical care nurse in London, United Kingdom. So I'm happy and thank you for having me here today.
Wow, awesome. Tristan, well, we look forward to hearing all about your take on the US. Sounds like you're a newbie, so we're excited to hear what you've learned.
Yeah.
Dan, let's go with you next. Oh, you're on mute. That one I can see.
Good morning. Much better there.
Yes.
Well, my name's Dan. I'm nurse manager with Float Pool. I have worked for Monument Health for 13 years. I've been a nurse for 10. I started as a nurse aide and worked my way into nurse manager after working intensive care for 10 years and doing chemo infusions. I was born in Rapid City, South Dakota, so longtime resident of this part of the country and world, and really excited to have everybody coming and meeting new faces and bringing a little bit more diversity to Monument Health. And this is just a great facility. Like I said, my entire healthcare career has been with this group, and would be excited to meet and welcome anybody who wants to come join us.
Wow, you started as a nurse aide and now here you are 13 years later. That is pretty amazing. Well, we definitely look forward to hearing a little bit more about that. Dan, thanks for joining us.
Happy to be here. Thank you.
All right, let's turn over to our ladies. Can we hear you? We can see you, but we can't hear you. If only we were lip readers. Okay, so nope. Looks like we got that mute button on and off, but we're not able to hear you. Okay, so it's me and the gentleman for now. We'll see if the ladies can come back. Well, thank you both for joining me this morning. We are so excited to hear a little bit more about Monument Health. And if you are following along and you are inspired by the stories of Dan and Tristan and you would like to apply on our website, our recruiters are on hand, they're ready, and they're waiting. You can apply at amnhealthcare.com/international, and our recruiters will gladly help you take your application. So we're going to drop that link in the chat. Okay, so before we get started with introductions about Monument Health and a little bit more about where you guys are located and your organization, we have a short video from some of your international nurses who were not able to be on the panel but still wanted to speak to our nurses worldwide, and they are going to do some introductions. So we are going to start with Guadalupe, who is going to introduce you to Monument Health. So let's bring on Guadalupe's video.
I always say I didn't choose South Dakota, but South Dakota chose me. I feel respected right from the start. Like, not just me being an international nurse, but as a person and as a professional. So I felt right from the start that I'm in the right place because the team, not just the entire hospital, but our team where I belong, PCU, is a great team where our voices, the nurses, are being heard by the managers. So I feel that as time moves on, the respect grows and we have a say in whatever is implemented, not just in our unit, but in the hospital.
Wow, well, what a way to start out with Guadalupe. I think at the end of the day, that's probably all we all need to feel, is to really feel seen and heard. So that's pretty amazing that she felt that right away. We look forward to hearing a little bit more from Guadalupe as we continue on with our show. Okay, we have our lovely ladies back. Can we hear you all? Let's see. Oh, no, we are still not hearing you. We can see your beautiful faces. So we'll work on those tech issues. Let's try get you guys on because I know you both have some wonderful things to say. While we're waiting for the ladies to figure out their sound and tech issues, let's turn to Tristan. You are a newbie, just arrived. Congratulations. That's extremely exciting. I'm sure it's a journey. As you said, you've been to many other countries before you arrived in the US, and that's so wonderful for you to finally reach your American dream. Can you tell us a little bit more about why you wanted to come to the US after bopping around in so many other places?
Yeah, I think a lot of nurses in the Philippines have a plan to go to the US, like a big percentage uh, of Filipinos like to go to the US. And then that was my initial plan when I joined. I studied nursing. Initially, I wanted to come to the US right away, but due to some circumstances, it was put on hold. And my journey was a bit tough because, as I mentioned earlier, I ventured to different fields of nursing. I went to the UK and as well as in Saudi Arabia. But I had a chance to take up the NCLEX while I was in London. And then I looked up online. And then I've heard a lot of good things about AMN and phonetics. And then so I applied and found Monument Health as well. So now I'm here and I'm very thankful.
Okay, so Tristan, it sounded like it was something you always imagined doing, and for whatever reason, circumstances may have delayed the plan, but you ultimately ended up reaching your American dream.
Yeah.
So that's amazing. Okay, thank you for sharing. Dan, I would love to hear from you. We're going to talk a little bit more about Monument Health and where you all are located. Can you tell us where is Monument located geographically in the U.S.?
Um,
What state?
Fun fact about where Monument Health is located in the U.S. is it's exactly the center of the United States. One of our small communities around here, Belfouche, is considered the geographical center of the United States. So we are located in Rapid City, which is in the western corner of South Dakota, and we service the area in the 350-mile radius, so North Dakota, Montana, Wyoming, and Nebraska, as well as central South Dakota. So a big service area. We are 260, just under 300 bed hospital with over 31 medical specialties, state-of-the-art surgical center that's relatively new, state-of-the-art Heart and Vascular Institute, as well as Cancer Care Institute. Really a great facility to service our population and community that stretches to such a large area. But right in the middle of the country, Rapid City, South Dakota, somewhat of a rural area in regards to what the United States has to offer, but that's part of the beauty of here, I think, is the wide open spaces, low population, safe area to raise your family. I'm father of a 5-year-old son, and live here in Rapid City with my parents and my siblings and their families. So really great place to come be part of.
Thank you for sharing, Dan. Well, you said a lot of really great things there. I'm excited to learn a little bit more about what you and your family love to do in South Dakota and in Rapid City, and definitely excited to learn a little bit more about Monument Health. We're going to focus on that as we move forward in the show. Let's see if our ladies have got sound now.
Can you hear us now?
Third time's a charm. We are so happy to hear from you both.
Yeah.
Okay, great. We're so happy you're on. Let's go back and give some quick introductions. So whoever wants to go first.
All right, I can go first. My name is Nkatia, one of the nurse clinicians in Monument Health. Just for those that wouldn't understand, the nurse clinician is just like responsible for nurse education, onboarding, and things like that. I've been with Monument since 2019, and I came to Monument as an international nurse as well. And I've been here since then with the float pool department. And in the float pool, we do float to about 12 different units in the hospital. And I love everything about that. So that's about me.
Oh, very, very nice. Okay, and Katya, where are you from originally?
I'm originally from Zambia, and that's we're considered southern part of Africa, though we are centrally located.
Okay, very nice. We're from a similar location. I'm originally from South Africa.
Oh,
So
cool!
I love South Africa. Part of the world, yeah.
Yeah.
Okay, well, we look forward to hearing more about your experience living in South Dakota. Sounds like you've been there for about 6 years.
Yes, and I love it.
Okay, we're excited to hear more.
Yeah,
okay, so let's turn to Dana.
Yeah, Dinah.
Dana.
Yeah, hi everyone. My name is Dinah. I'm originally from the Philippines. So I've been a nurse in a clinical setting for almost 21 years. And before I came here at the Monument, I was in Saudi Arabia for 17 years.
Okay, well, we are very excited to hear from both of you all about your experience living in South Dakota and coming as international nurses. I'm sure you have a wealth of knowledge. So thank you guys for being on. I saw some comments in here. Looks like your sister is watching, Diana, or your brother, Hector, is watching.
My brother.
Your brother Hector is watching. So that's awesome. Hi, Hector. We are very proud of Diana as well. And looks like, in Katya, you have a comment from Teresa who says, love from Zambia.
Oh, so thank you.
We have got nurses watching from all over the world, everybody. And if you have any questions for Dan, Tristan, and Katya or Diana, please feel free to put them in the chat. We're going to be taking questions as we continue to go through the show. Okay, so Tristan shared with us why he wanted to come to the United States. Let's give Diana and Katya also an opportunity to share with our audience why you both decided to come to the United States. And Katya, let's start with you.
All right. So the reason I decided to come to the United States was I wanted to experience something different in terms of my career, and also to kind of like grow my career, because um, coming from Zambia, we don't have the like everything else that the hospitals here have. We have to improvise a little bit more to take care of our patients. So I just wanted something more, something different to help grow my career. And I thought relocating to the United States would give me that opportunity. And I think it has given me that opportunity. And I enjoy everything about nursing. I love, 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 love nursing. I love my career, and it gives me like that satisfaction that I'm able to provide care with all the resources available to my patients. So the reason I wanted to relocate really was to just grow in my career and experience something that's different that my country was not able to offer in terms of my career.
Well, I'm sure that really resonates with a lot of international nurses that might be sitting in their home countries and feeling like they want to grow their careers. They want to feel like they have more resources to give better patient care. So thank you for sharing, and Katya.
Yeah, thank you.
Diana, let's turn to you. Why did you want to come to the United States?
Well, actually, with this long time working in Saudi Arabia, I actually thought I'm settled. I mean, my salary is not bad, and I'm able to provide my family back home in the Philippines. But when you have a growing family, you think about their future. You think about your personal and your family's future. And I think here in the US has more financial and job stability, and perhaps a greener pasture. So yeah, so I decided to take my NCLEX, and with God's grace, I passed the exam, and I'm here.
Well, we love that you're here. I think that probably also really resonates with a lot of nurses and just immigrants in general. I know for me and my family, we really felt that we wanted to have a better life. My parents wanted a better life for us, more opportunities, as you said, greener pastures. So that definitely makes sense. I'm sure a lot of nurses who are watching along feel the same way. So thank you for sharing, Diana.
Thank you.
Okay, so we learned a little bit of an introduction from Dan, all about where Monument is located. I'd love to learn a little bit more about the location. I have been living in the United States for about 25 years, and I haven't done enough traveling. I need to get over to South Dakota and Wyoming. I actually live in California now, and I would love to learn, as I'm sure a lot of our nurses would love to learn, all about South Dakota, all about Wyoming. Dan shared with us that you are located in the central United States. Let's bring up that map again so we can see where South Dakota and Wyoming are located. So right there, spot on central. So let's hear a little bit more about the climate, the transportation, fun things to do. We just want to hear a little bit more about the area. So let's start with our newbie, Tristan. What have you learned living there in the last 2 months? What are some fun things that you've learned about South Dakota and Wyoming?
First and foremost, I think being here, I learned that driving is really safe because people here are driving really carefully. And I think it's a great place to be and to raise a family because yeah, shopping is decent. I live near Walmart, by the way, so which is an advantage. And there's a lot of good people. They're really nice. So I've had some random people just wave at me while I was walking on the street, and someone who says hi while I'm in the grocery store. And then the best thing about the area is how close it is to nature. Although I haven't had a chance to go around a lot just yet, the Black Hills I heard is a beautiful and family friendly, and there are a lot of several activities that will be good for kids, like animal farm in the summer, exploring the caves and hiking opportunities, which I'm looking forward to do. And not to mention the famous Mount Rushmore, which has a very rich history. And that's it.
Hmm. Well, I'm sure for a lot of international nurses that are watching along and might think of the US as this big, scary, busy place, and you're imagining cities like Los Angeles and Manhattan, and just your head kind of explodes. It probably will sound very nice to hear that people are waving at you and that it's safe to drive. I mean, those are things that can be very scary when you're coming to a new country. So that's very interesting to hear. I love that, Tristan. Diane, I see you smiling over there. Can you tell us a little bit more about what it's like living in South Dakota and Rapid City? Tell us about
Yes.
the climate. Tell us about fun things you like to do with your family. We'd love to hear more.
Yeah, as Tristan said, it's really safe. And people here at South Dakota, they are really disciplined. I mean, if it says 35 miles per hour, then you can just they will just obey what's that the sign is. And yeah, we went to the neighbor state like Wyoming, Denver. So we kind of love nature. So especially if it's summer here, all greens. And I can still remember the first words I told to yeah, that's my husband. So I actually told to my husband when I came here in Rapid City, I said, why there's no flying plastic garbage here? I mean, it's so neat, it's so clean, and so peaceful.
I love that.
Yeah.
Why is there no garbage everywhere? Well, that sounds amazing. A city
Yeah.
that's clean, that's beautiful, that has good weather, good climate, that has nature. That sounds like a very, very beautiful place to live.
Yeah.
Dan, you are our longtime resident. What's the reason that that you stay where you are? Why do you love living in South Dakota?
So, like I said, I was born here. So for me, it's home. I moved away for quite a while, but what brought me back is just the pace of living. It's a slow pace. Like the panel said, people follow the rules. It's very friendly. It's not uncommon to just say hi, how are you doing to a random stranger and make a friend out of them. Growing up here, that was kind of one of the things that was a joke, was a stranger is just a friend you haven't met yet. And I think the people of South Dakota really value that trust and community and friendship and ability to help each other out. It is a very clean community. It's small. Rapid City is about 75,000 people, um, and you're a 10-minute drive from the Black Hills. So into that nature, that scenery that showed of the granite peaks and the trees, those truly are our backyard. So just a quick drive and you're at the lakes and the streams and the mountains. Although more rolling hills, but there are rocky outcrops, and it's just a beautiful place to live.
Wow. Well, thank you for sharing, Dan. I love that a stranger is just a friend you haven't met yet. That is a really beautiful way to put it. I used to live, not anymore, but I used to live in a big city, and everybody walks around like this. Nobody's waving to you, nobody's friendly, everybody's going about their day. So I think that sounds pretty amazing to be in a place where random strangers are waving to you and you have that trust in your community. I see the whole panel is going like this, so you know that it's a true statement. Can you tell us a little bit about housing and cost of living? You've been there for a few years now. What do you think are some pros and cons about living in Rapid City in South Dakota that our nurses should be aware of?
So, um, that's a very hard question, but I'll try and answer as best as I can. So when it comes to housing, housing is really easy to find. But when it comes to prices, it just depends on what somebody's looking at and what location they're looking at and where they want to live. But I would say pretty much South Dakota is a safe place, a safe area. So housing can be a little bit a little bit pricey, but not very pricey. Not something that somebody cannot manage, something that anybody else would manage with what they're getting here. And also, in terms of other cost of living, I would say it's not as expensive as it would be in urban areas. It's got a lower cost of living um, compared to bigger cities or urban areas. And yeah, housing very easy to find, and it's reasonably priced, is what I would say. Yeah.
Well, I'm sure that's very helpful to hear. I actually, as you were talking about housing, I was thinking about where I used to live. I used to live in Los Angeles, and housing there, it's a big city in California. It is so expensive. It's so hard to find. It's very stressful. It's not an easy situation. So knowing that there is available housing, there's reasonable housing, I'm sure I see everybody kind of going like this. I'm sure that was definitely a big reason to come. I did a comparison looking at the cost of living between Rapid City and Los Angeles, and I'd love to share what I found with everybody. So the cost of living is 56% higher in Los Angeles. And if we look at that housing cost in Los Angeles, it's 178% higher. So a very reasonable cost of living compared to living in a big city like Los Angeles. We also did a comparison against Manhattan and New York, and we saw that the cost of living is 141% higher in Manhattan than it is in Rapid City, with housing 513% higher. So I would definitely echo what you said, Katya, that the cost of living is very reasonable. Living in the United States, all things are expensive at the end of the day. It's a big change, I'm sure, coming from an international country, another country, and coming to the US. But all things considered, a much more reasonable cost of living. I think that was a good word that you used there.
And also, it's a growing community as well. So we've had, for the time I've been here, I've seen so many new apartments being built. It's really easy to find a place to stay. You won't struggle.
Amazing.
I am living in a new apartment, actually. So
what was that, Tristan?
I'm living in a new apartment.
Oh, well, there you go. I mean, go ahead.
What's funny is it's almost of the same price as my ensuite room in London. Now I'm living in an apartment which has a living room, one bedroom, and has a washer and a dryer, which is really nice.
Wow, and that is almost the same as what you were paying in the UK?
Almost the same.
Wow, well, there you go. Very reasonable cost of living, and you get more bang for your buck is what I'm hearing. Okay. Okay, so let's turn to something fun. I would love to hear, what are your favorite things to do in the area? So let's start with you, Dan.
Okay. I love to be outside, having the Black Hills as my backyard. Like I said, 10-minute drive from my front door, and I can be in what feels like the middle of nowhere in the woods and find peace and solitude. There are thousands of miles of hiking and mountain biking trails, and I love to do all of that. I love to do that with my family. Fishing is a fun pastime as well, and there's world-class trout streams right here in the Black Hills and lakes that are just full of fish, and it's just summertime is pretty magical out here. In the winter months, where we do get a lot of snow, skiing and snowboarding, snowmobiling are options. I love to snowboard, and I've been trying to teach my son how to do that as well. It does get cold here in the winter, negative 20 degrees Celsius, but then our summers get hot up to about 43 degrees Celsius. So we do have all four seasons, which offer their own beauty in this as your backyard. You can get out and really enjoy all of that year round, and that's what I love to do. That's what kind of re-sparks me to just have fun and be outside.
Well, that definitely makes sense considering the background picture that we see. That looks like a beautiful view. Is that South Dakota?
That's actually the Grand Tetons in Wyoming.
Oh, okay. Very beautiful.
Yeah, it's a gorgeous area. Huge mountains. Yellowstone is located primarily in Wyoming, which is just a short drive away, and Montana. So, really, that central location that you have here provides a lot of opportunity when you have time to get out and enjoy a lot of this area.
Very nice. Well, thank you for sharing, Dan. We actually have some fun facts about South Dakota I'd love to share with everybody. So let's bring up those fun facts. So South Dakota is the 6th happiest state in America. I thought that was amazing to hear. The 13th best state to retire. No personal or corporate income tax. I saw there was a question from Hanson in the chat about income tax. No income tax, so that's exciting. And the 3rd lowest unemployment rate in the US, 2.9%. So those are some pretty amazing stats and makes sense why there has been so much building and growth in South Dakota. Sounds like there are a lot of incoming populations. So very cool to see. So Tristan, let's turn to you. What is your favorite thing to do in the area?
So since I'm fairly new here in South Dakota, I haven't had a chance to like go around just yet. But one of the favorite things that I do is just drive around downtown, because which has a variety of restaurants in there as well, and some coffee shops. I try to go around some coffee shops as well because I love drinking that black Americano.
So how's the food there?
The food there is like they have some dishes like Indian and as well as Nepali, which I love, but I haven't had a chance to really just go out and eat just yet.
Okay. Well, sounds like there are some options for you. So that's good to hear. I'm sure a lot of nurses are thinking, what kind of food options are available for me in that central part of the country? So that's good to hear. And Katya, could you maybe share with us a little bit more of the culture, what it's like? You know, I'm thinking about what Dan said about a stranger is just a friend you haven't met yet. Is that kind of what the culture really feels like over there?
And that's how it feels like. And I would say that's one of the reasons I decided to stay after after so many years. I decided to stay with the hospital. It's a very like close knit community where you feel like home away from home kind of feeling. Um, Everyone is super friendly. Like everyone is willing to help you. Like sometimes you don't expect a stranger to help you, but they are always willing to help you. And you're like, oh, okay. So everyone is super friendly, and when it comes to work, you feel like it's your second home. Because we spend more time in the hospital. Our 12-hour shifts were here, and so it feels so like welcoming that everyone is just super friendly. And after that, I decided I've traveled to different states in the United States because I love to travel. So I've been to different states, and I just still feel like South Dakota is my other home. And I decided to just stay here because of how friendly everyone is and how nice, and it's just a beautiful community.
Wow. Well, I think that says a lot that you decided to stay there after so many years. So Diana, so before we start talking more about Monument as a health system, I just wanted to ask one more question. You mentioned that you have children.
Yes.
Could you tell us a little bit more about the schools over there and how that's been for you?
Well, actually, the school haven't started yet, so it will start on by August. But we did inquire about the schools, and they are really helpful, and they don't need a lot of documents. They just need birth certificate and vaccination card. So, yeah, I was able to enroll my high school, who will be on grade 10 next school year, and my son who's having a therapy also. So I was able to like enroll him also. So it's pretty easy. It's pretty easy to like find a school here and get like a therapy that you need. So it's easy. It's accessible actually.
Okay, well, that's good to hear. And is it free to enroll your kid in school?
Yes, high schools here are free, and they have school buses as well. Free school buses.
Wow. Okay. Well, those are some very good things to keep in mind. The public education system is very good in the United States, and always great to know that you don't have to pay for that. So I'm sure that your son will do very well. Son, right? You said?
Yes.
High school. Okay, we wish him luck.
Thank you.
Okay, so let's hear a little bit more from some of your international nurses. We have a short video from Elena and Dion to talk about life in South Dakota. So let's hear just a little bit more from them.
The work culture here it's family oriented. We take care of each other. We try to work with everyone to help cover work hours because we do understand that there's a balance between work life and as well as being home. You know, I come from an island in the Caribbean that's very far away, and I chose to stay with Monument because of that family environment that our staff has created here.
It's a familial feel. Everyone's welcoming, everyone looks out for each other, and not just here at work. They are also invested in your family, how you're acclimating to the area, and ensure that everything is going okay. If you need additional resources, they will help you with that as well.
Okay, well, that was great to hear from more of your international nurses. It looks like you have a very growing and beautiful community of international nurses, which I'm sure is very exciting for our audience to see. So, Dan, you gave us a little bit of an overview on Monument Health. Let's go back to that. Let's dive in. Can you reintroduce us? Give us a brief overview. Who is Monument? Who do you guys serve? Tell us all the important facts.
Okay, yeah, happy to. So Monument Health is in Rapid City. It's our main hospital. We service the area of Wyoming, Nebraska, North Dakota, and all of Western South Dakota. We are the only hospital out here. We are about just under 300 beds. We have 31 medical specialties, including cancer care, Heart and Vascular Institute. Up here, yeah, we have been partnered with the Mayo Care Network for just over 5 years now. If you're not familiar with the Mayo Care based out of Minnesota, one of the larger hospital systems within the United States, and our partnership with them has been very successful as far as offering the best care to our community. Our hospital here, where we are hiring, is into our progressive care and ONS units. We have 12 areas of the hospital that we work in, and all state of the art. We're transitioning constantly to the next and best to help our community. Really a great teamwork feel through here. Work side by side with licensed nurse aides, as well as work very closely with our providers and physicians. It really is a great team, from surgical services to anything that you can offer for patients to just really give the best care.
Okay, thank you for that overview, Dan. If you are watching along and you have more questions for our panel, please feel free to post them in our chat. We are talking all about Monument Health and learning all about the system, why everybody chooses to work there. So if you have any questions, feel free to post them and we will ask our panelists. So Tristan, can you tell us, what has it been like working at Monument?
Yeah, so I was enticed of applying in Monument just because it is a magnet hospital, and it is rewarding as they promote nursing excellence, which could lead to improved patient outcomes, which is always the priority. So I feel safe working as a nurse here because of their, as Dan said, of the state-of-the-art facilities that they have. Their policies are in place. They have a good support system, especially from the managers and seniors and even other colleagues. So the management was very easy to get along with. The managers are doing great at um, making you feel supported and important. So the interaction with patients is always humbling. And the team is very friendly and fun and very helpful with all our queries, especially to me as a newbie here in Monument Health.
Wow. Okay. So you said something that I really want to hone in on. You said that Monument is a magnet hospital. So what does that mean? I see everybody kind of going like this. And Katya, can you tell us what is a monument hospital? What does a magnet hospital mean? You know?
I think let me let Dan answer that one.
Okay. Let's see. Dan, what's a magnet hospital? Oh, mute. You're on mute.
Our magnet recognition is through the American Nurses Credentialing. It does promote nursing excellence. We received that title, I believe, 8 years ago, which just really solidifies Monument Health's commitment to nursing excellence. Not only are we magnet recognized, but we also are the only hospital in South Dakota that has a level A safety rating. So both of those, very specific to Monument Health, really highlight our commitment to patient care and patient safety and nursing excellence, truly.
Okay, so what I'm hearing is that having magnet status is like the gold standard for hospitals, and only about 10% of hospitals have that magnet status. So it's a pretty impressive accreditation to hold, right, Dan?
Yes, it is. Yeah, it's quite an accomplishment and an honor for our hospital, and really reflects how amazing our nurses are.
Very, very interesting. Okay, well, thank you for sharing that, Tristan. I'm sure that's something that a lot of nurses want to take into consideration because it really is that golden standard in nursing. And Katya, let's go to you. What has your experience been like working at Monument?
So my experience has been really great. So one of the things is we have a very supportive environment. So Monument Health offers that culture that supports teamwork and also professional growth. So it's a place that has helped me thrive in my career. I started out as a float pool nurse, and they offer a lot of mentorship opportunities and continuing education. And here I am now, I'm a nurse clinician. So that just reflects of how great of a place to work. And also, like Dan mentioned, being a part of the Mayo Clinic, it helps nurses collaborate and like on complex cases, and we benefit a lot from the best practices and educational resources as well. And I think, like I said earlier, it feels like a home away from home. Um, Patient ratio really good, work-life balance really good. Our leaders are really, really supportive when it comes to work-life balance because they want us to have that outside work. And so it's been really great to work here. And Monument Health's values, they're just not like slogans. They really put that into practice, and nurses here are able to make a difference and advocate for their patients and be a part of that interdisciplinary team. So it's been really awesome to be a part of Monument Health and be able to just be part of the family of Monument.
I love that. Be part of the family. You can really tell that this is a very close-knit, welcoming group to go into. So thank you for sharing that, and Katya. So Dan, I have a question. I think it's going to go to you. In the chat, we have a question from Nana. Nana is asking about the requirements. So what are you looking for in international nurses that you're going to be interviewing? How can they stand apart from other applicants?
So right now, the applicants that we are looking for have their bachelor's degree and have passed their NCLEX. The majority of hires that we have been with the H-1B visa and P3 as well. So really the bachelor's degree is what we're looking for hiring in right now.
Okay. And what I see a question from Faiza. Faiza says, what is the minimum work experience you require to work there? Are you guys looking for a minimum work experience?
So it depends on the experience, but typically we're looking for a couple of years of experience. Um, we're not trying to train new nurses, but we do understand that coming in and learning our charting systems and our workflow will provide their own unique challenges. So our focus is on just um, getting you used to our system. The two areas that we are hiring into are considered a step-down unit or progressive care, as well as our orthopedic, neuro, and surgical recovery area. So it's not really a PACU, but an inpatient post-surgical recovery unit.
Okay, thank you, Dan. I'm sure that's very helpful for nurses who are watching with questions about what you are looking for. So if you have any more questions, please feel free to put them in the chat. If you would like to apply, you can apply on our website. That link is amnhealthcare.com/international. And our recruiters are on hand, ready and waiting to help you reach your American dream with Monument Health. So, Diana, I see a comment from Divinia from your mom. Proud mom over here. So shout out to mom.
Hi, Mom.
So can you tell us, all of us, your mom included, why an international nurse should really consider Monument at the top of their list? You know, there's lots of options out there nowadays. Why do you think Monument should be at the top of the list?
Well, I just want to share like some stories. I passed NCLEX month of May, and I signed up with Monument month of December through AMN. So within that span of time, I was able to compare some other offers and other offers of the agencies, and Monument has the best offer that I got, and I will like Monument, as Tristan said, it's a magnet hospital. Like I'm feel safe practicing my skills, and as I said, people here are so warm and friendly. I mean, they are very supportive, very helpful. um, you don't even need to ask for help. They will come to you. Like if you are confused of something, they'll walk through you with it. And yeah, people here are, we have a good teamwork here. So yeah.
Okay, so if somebody is watching along and they want to go to a place where there's good teamwork, where they can feel safe practicing as a nurse, they're at a magnet facility, so really that gold standard, it sounds like Monument should definitely be at the top of their list.
Yeah.
Okay, and what about for you, Tristan? What was your experience like coming with AMN and now starting to work at Monument? I know it's still fresh and new, but what was really the deciding factor of why you decided to go to Monument?
To be perfectly honest, I didn't have any other choices. Once I saw how Monument, and once I got the offer from Monument, I took it right away because apart from their building is very beautiful from the outside. And I've read through their policies and all that stuff, and uh, it was like when I was in the hospital already. It was really true that that Monument is really a great hospital to be in because of their warmth and um, friendliness. And as I mentioned earlier, I really feel safe working as a nurse here because of the support that I get from all the colleagues that I have. Yeah.
I love that. And you know what? I did a little chuckle when you gave your honest answer, but I actually think that is a perfect answer because for a lot of international nurses, number one, when you get the right offer, why wait? You should just take it and run, especially in this competitive landscape where we are experiencing retrogression, you don't want to delay your processing any more than you already have. And when you have an amazing offer, you take it. So I love that answer, Tristan. Thank you for sharing. And I'd love to hear a little bit more from your other international nurses. As we said, Monument has a growing and thriving international nurse community. So let's hear a little bit more from Guadalupe, Elena, and Dion about their experiences working at Monument Health.
The work culture here is.
I started out as a nurse on the floor working bedside and worked my way up to charge nurse through what my managers, my leaders saw in me. And of course, I grasped that opportunity. And then now I am a nurse clinician educator. So there's lots of growth opportunity. It is what you want that you will work towards.
We might come from different backgrounds and we might look very different, but inside all of us, we're very alike.
I really do love the people that I work with. It's different when you go to work and not feel that you're going to work. You feel that you belong to a family, that no matter what happens, I always say no matter how hard it gets, you know that the team is there to back you up and to support you.
So when I came here and saw the warmth of the people, I decided this is home.
Okay, well, I love hearing from your international nurses. I'd actually love to hear a little bit more about your international nurse community. I think, Dan, you would be the right person to ask, but feel free to give the question to anybody else. Can you tell us a little bit more about the community you're growing there?
Yeah, I'll do my best, and to my group and friends here, just chime in if you have anything to add. But Monument Health started its international nursing program in 2017. So since then, we have been bringing nurses in, many of whom who have chosen to stay and make this their home, which has just been such an incredible experience to keep here in Rapid City and offer some growth and diversity to our community. Many of them that have stayed have advanced in their careers. Natalia, for example, starting in as a nurse clinician, and several others have taken that path as well, or into the charge nurse role as they've just settled into our community over the last 8 years, coming in on a decade. We, I guess, have been growing this program and just really fine tuning it now, especially I think and would hope that Dinah and Tristan's experience, would be very different than Nakata's, which is a few years ago, but we do a pretty substantial onboarding and orientation process so that we really try to get you comfortable and check in with you before we're letting you practice independently. And like Tristan had said, we want to check in often and just really make sure that you're feeling good about where you're at, not only professionally, but personally.
Okay, I think that's a really good segue for us, Dan. I think for a lot of nurses who might be looking at this kind of program, they might be feeling a little bit anxious. It's exciting to come to the US, but it's also very scary. And especially practicing nursing in a different environment than you're used to, that onboarding process can be very, very key. Tristan, can you tell us a little bit more about your onboarding program? What was it like? How do you feel now? How did it help you? Any information you can share there with our international nurses.
First and foremost, I'm really happy that I applied with AMN because they supported us from looking for an employer to obtaining a US visa. So they set online meetings which they align with my schedules and my availabilities. And then they do not pressure us with the required documentations and will advise us on how you will obtain them as well. So they were very clear about the process of the entire application. They were very responsive of our queries and what's on our minds, and they give assurances that we will be in the US. Although there has been some delay that happened, which is beyond their control, but we were never denied, and now we're here in the US. And then when I came here in the US, representatives from the HR, I mean from Monument Health, picked us up in the airport, and right there we obtained a US mobile number, and then luckily we got a free phone from one of the mobile clinics here in the US, and then they put us in a good accommodation which is fully furnished, with welcome grocery packs, and then they were quick with obtaining our social security numbers and as well as our bank accounts, which only took us around less than a week. And then they helped us look for an apartment which is appropriate for our liking. And then Monument Health is very organized with our schedules. We have nursing education for 2 weeks, and then we have some orientations, and then they gradually immersed us in the area we will be assigned to. So we have a 12-week preceptorship program, which is very helpful for us, especially as newbies here in the USA. And then, yeah, that's it.
Wow. So sounds like you had a really robust and helpful onboarding experience when you came to the US. Would you agree with that?
Yeah, I agree. So I was thinking that have, I might experience a lot of stresses when I arrived here, but it was otherwise. I mean, it was very smooth, and it was the stress that I was anticipating wasn't there at all. Just a little bit, but not as much as I was thinking about.
Well, that is amazing to hear, Tristan. I'm sure that was a big relief when
Right.
you came to the US. So Diana, I want to hear a little bit from you about your experience onboarding. What kind of training did you receive? How did it feel for you when you arrived with your family?
Well, I think it's normal. Like at first, it's actually overwhelming. It's normal feeling for anyone who came here to a new country that you're not familiar living with. So, but with the help of AMN, they are really from the start. They are here. I mean, until now, I'm still in contact with our board specialist, Miss Meredith, and with Miss Rona. Shout out Miss Rona. Yeah, they are always helpful and supportive. So until now, I'm still updating with them. And when I arrived here, same as Tristan. So since I have a family, so I was actually thinking that they will might be give us only one bed, but yeah, they give us like fully furnished apartment with two beds, so my kids can like hang out. It's actually a bunk bed, so it was like a kind of surprise, like wow, they really take care of us, and they took us to the apartment, and yeah, I mean, even if it's weekends, weekdays, you need help from them, they are just message away and they'll respond.
Well, I'm so happy to hear that you both have had such a good experience, not only with AMN, but also with Monument, making sure that you were adequately trained, that you had a good arrival experience. It can be very scary when you're moving to a new country. So it sounds like you both, of course, you're going to have stresses because that's just what happens when you move to a new country. But it sounds like you both had a relatively good transition so far. So that is so good to hear, and we're so happy. So I see a couple of questions, and I know we are almost at about time. So Dan, I'm going to turn to you. Hanson is asking if the H-1B process is CAP exempt. Do you know the answer to that?
I don't. I saw that question pop up, Hanson,
I
and
can
I
give
was
you
wondering.
the answer.
You do.
Yes, you are not subject to the cap. So you can bring as many international nurses as you would like. So there you go, Hanson. You're not going to have to go through the lottery with Monument. So that is good. And then Nana is also asking if you need to pass your NCLEX before you apply. That is a good question, Nana. And the answer is yes. I see Dan shaking his head like this. that is really your golden ticket to come to really anywhere in the United States. You need to pass that NCLEX in order to apply for your immigrant petition. So I want to give everybody one last chance to give their best pieces of advice for international nurses who might be watching and considering Monument as an option to come to the United States. Let's start with Enkatia. What kind of advice do you have?
All right. So my advice for anyone that wants to come to South Dakota, I would say it's got a lot of diversity. Our environment is very inclusive. So if somebody is wanting to maybe grow their career or just a stepping stone or find just a place that feels like home, I would say this is a place, and Monument Health is a place to come to. We have very great teamwork, very diverse. Like everyone that comes here ends up finding somebody from where they come from, at least. At least. And then we still, despite being a small community, we're still able to find the food that you're familiar with online buying and stuff like that. It's a place to be because of just teamwork, the inclusiveness, and just the diversity too. So that's what I would say.
Well, I love that, Enkatia. You really hit the nail on the head, I'm sure, when you said you can find somebody, almost anybody at the hospital from an area that you're from or a country that you're from. I'm sure that's a really good feeling to see somebody who's familiar, someone who's from your home or from your country or from your region. So that must be a pretty amazing feeling.
It is.
Very nice. Well, thank you. Thank you for sharing. Diana, any last pieces of advice?
Yeah, actually, my advice is for in general, and it's kind of short. So, I would say that the road to success is never straight. It's never easy, but don't give up. Just hold on. Trust the process. That's
I love that. You know what? At the end of the day, control what you can control is, I think, really in line with what you're saying. You stick to your process. You control what you can control. Take your NCLEX, take your English exam, continue on with your processing. Then eventually you too can reach your American dream. So I love that, Diana. Thank you for sharing.
welcome.
Tristan, let's turn to you. Any last pieces of advice for a nurse who might be considering Monument?
Yeah, for young nurses, you have to strike while the iron is hot, and strengthen your CV or resume, and then take the NCLEX right away. And for old nurses, because I'm in my 40s already, so as they say, age is just a number. So there's no age discrimination here in the US. But you have to choose an agency with a strong reputation, with strong experience in international nurse placement, which is AMN and Monument Health as a whole. And then prioritize the agency that offer comprehensive support, including visas and relocation assistance, and as well as cultural onboarding. So I believe that AMN and Monument Health has those qualities. So that's it. Thank you.
Well, thank you, Kristen, for sharing. I cannot believe that you're 40. I see no wrinkles there. You feel great. I'm jealous. Well, thank you for sharing. I think that really hits the nail on the head. When you are looking at coming to the US, you really want to come with someone that you trust, and you really want to go to an employer that you're excited about. Someone that you're going to be coming and is going to support you through the process. So thank you for sharing, Tristan. So if you are interested in applying, you can apply at our website, amnhealthcare.com/international, and our recruiters are on hand, ready and waiting to help you with your application for Monument Health. This is an amazing opportunity, an amazing health system. So as Tristan and Diana have said, strike while the iron is hot, take advantage of the opportunity, and make sure to make the most of your time. So Dan, last but certainly not least, any final pieces of advice?
apply, reach out. This is an incredible place and an incredible organization to work for. We have a saying to love where you live and work where you love, and that is what Rapid City, South Dakota has to offer. Is just an amazing community, an amazing backdrop and landscape, rich cultural history in this area, and just, we want to work with you and have you be part of our team. So like our panel said, take your NCLEX, take your English exam, apply, and I'll be a face that you see then in the interview process, and I'm looking forward to it.
Okay, thank you, Dan, for sharing. I'm sure those are great words for our nurses who are watching along and considering is now the right time. But there's no time better than now. Get started with your process. Look for a reputable agency that you trust. Look for an employer that you are excited about, that you're going to be welcomed with open arms, like Monument. I always say, look at where the people who have been there, how long have they been there? How are they feeling while they're there? You can tell by this panel, there's a lot of warmth, a lot of love, a lot of community. And when you're moving to a new place, those are key things. Those are so important. I can't understate that enough. So I see we did not get to a lot of questions in the chat. We will get to those after the show. We only had so much time today, and I know we went over. So thank you to my panel today for sharing your insight, for sharing your love, for sharing why you are a part of Monument. It was so interesting to hear, and I'm sure very inspiring to a lot of our nurses. So thank you all for being here today.
Thank you.
Thank you,
everybody. If you were inspired today and you would like to become an international nurse at Monument Health, please feel free to apply at our website. That's amnhealthcare.com/international. You heard all about what makes Monument an amazing place to work, what makes South Dakota and Rapid City an amazing place to live. And now is the time. So take advantage of this opportunity. Let's bring up our upcoming shows for the rest of the month. So we have got our AMN Academy, which will be every Monday at 5 a.m. with our partners 9.09er, iPass, and Aspire. So these are all free classes, everybody. So if you have not taken your English or your NCLEX, make sure to take advantage of these classes so that you can get started with your processing. Let's also bring up our schedule for the rest of the month. Next week on May 30th, we are going to be having another employer showcase featuring Methodist Le Bonheur Healthcare out of Tennessee. And then on June 13th, we will have our once a month immigration Q&A. I know lots of questions all about immigration, about processing. So please visit us at both of those shows. Come ready with your questions and we will be excited to take them. So thank you, everybody, for joining us today. Thank you once again to our amazing panel from Monument Health, an amazing partner with AMN. We are so excited to continue recruiting and growing their international community. And if you would like to be a part of it, please apply today. So thank you, everybody. Onwards and upwards. We'll see you again soon.